Good morning, everyone. My name is Taehun Park, a third-year pharmacy student here at Otago. Thank you for giving me the chance to share my vision as I stand for IPSF contact person. This talk is not only about pharmacists past and future, it's about why having me as CP will open real opportunities for all of us at Otago. Let me begin with where pharmacy itself began. Pharmacy began right beside patients. Dioscorides, often called the father of pharmacy, wrote the Book of Pharmacy. In it, he documented more than 600 medicines, their origins, use, preparations, and application. By organizing therapy into empirical and scientific knowledge, he left us the very foundation of Western pharmacology, and it became the basement of the pharmacopoeia of all the countries. Pillars of pharmacy are manufacture, discovery, and rational use. Dioscorides announced use, rational therapeutics, into a discipline. He left behind an oath, and in Greek and Turkey, students recite the Dioscorides oath. Serves the health of humanity. Here in New Zealand, our white coat ceremony invoked the code of ethics. Important, yes, but it lacked that greater mission to serve humanity itself. In the 20th century, medicine was redesigned for safety, standardization, liability, and efficacy. Prescribing was centralized under medicine, and pharmacies became gears of supply and dispensing. This was not a battle we lost to doctors, it was the outcome of structures and of losing our seat at the table. But the cost was losing our collective voice, our authority to decide. The frame of doctors treat, pharmacists dispense, hardened. Our knowledge deepened, but the potential to design and review therapy remained tied down by structure, because we, as a pharmacist community, couldn't communicate. So this was not a unique to us. Globally, physicians subdivided into specialties to preserve prescribing, while pharmacists followed with specialist or prescribing roles, yet often these were consumed as support, relieving physicians' overload, but full potential of pharmacists to prescribe to lead therapeutic planning remains structurally constrained. But there is preparation underway. In our schools, pharmacists are trained through care plans to design and manage therapy from start to finish, preserving the educational foundation for a future restoration of our full professional role. In Korea, that began only about 10 years ago, showing why international exchange and shared growth among pharmacy schools is crucial for advancing pharmacists' role worldwide. So in Korea, even generic prescribing is not legal. Pharmacists there have lost the vital role of second-checking prescriptions, reduced largely to dispensing and basic counseling. New Zealand, in contrast, has been progressive. Pharmacist prescribing, public health campaigns, expanded scope. But here too lies the paradox. Pharmac's tight budget and its aggressive negotiations mean new medicines arrive 10, even 20 years late. The intention of affordable access too often results in delayed treatment opportunities. So pharmacy is not bound to one organ or one specialty. It is life itself, but our undergraduate years cannot capture its full depth. Perspective is widened only through exchange and experience. This year, through IPSF student exchange program, I joined peers from Korea, Singapore, and across Europe, 7-ish countries for a month. I immersed myself in hospitals, pharmaceutical companies, regulators, professional associations, and classrooms. Not just visits, meaningful dialogues with leaders who shape policy and practice. I spoke with policy directors of the Korean Pharmacists Association, global heads of the Green Cross, and research and development directors of Corfin Bio, also a company, and regulators of Korean FDA, and clinical pharmacists at Seoul National University Hospital. And every discussions challenged me to see pharmacy from new angles. Then, back in Otago, I shared these insights with professors, reflecting on global cooperation, common challenges, and future potential. My vision is clear: to advance pharmacy as a profession that truly serves human health. I will begin as a clinical pharmacist, moving into R&D, and then medical affairs, where pharmacy meets physicians. Long term, I aim to contribute to WHO and drug policy and access, and eventually return to academia to train the next generation. The spark of this vision, it came from the international exchanges and sharing opinions I experienced through IPSF student exchange program, and also keep contacting them. So pharmacy cannot be isolated. Around the world, pharmacists are tightly connected, discussing common problems, learning from each other's precedents, and co-developing solutions. Our responsibility is to maximize these connections and apply them efficiently. I want to be a bridge between Oceania, Korea, and New Zealand and the wider world. I'm running for IPSF-CP because international experience should not be a privilege for a few, but a pathway for any otaku student. As a CP, I will represent NZAPS-O in IPSF, coordinate patient counseling and public health campaigns, and working alongside the student exchange officer, promote and prepare students for the exchange programs without overstepping its operations. My concrete plans: first, co-led activities, case discussions and skill shares, co-designed with peers abroad. Second, a language and cultural body program, where we compare patients' leaflets and counseling strategies. Third, a resource hub, guides, templates, timelines, which will be transparent, accessible, and practical. So let's begin together. Yeah, obstacles exist, but clarity of roles reduces fear. Data and outcomes reduce resistance. We can start small, show results, and scale. Global pharmacy must not remain the privilege of a few. It must be a pathway for all if you want it. Half the journey is already done. Join me through a body program, through a case discussion. Let's begin together, as I said, and I ask for your vote. Taehun Park, IPSF contact person. Thank you.